Well, hello, everyone, and welcome. We're going to jump right in from the beginning here because we have a lot to talk about today. I'm Dr. Nora Felposh. I am a psychiatrist that specializes in college mental health and the founding medical director for Mantra Health. And I am delighted to be here with three panelists today to talk about crisis and suicide interventions. Specifically for faculty and staff. So what really kind of kicked off the idea to hold this webinar was a survey that Mantra did, talking to faculty and staff across dozens of colleges and universities within different departments, administrative, clinical, and the majority said that they're worried about a mental health crisis occurring on campus. And many, if not all of them, have been approached at least once by a student regarding mental health concerns, which makes faculty and staff a potentially critical gateway to prevention services, which is kind of why we're here today. About 75% of the folks that Mantra talked to said they would like more suicide prevention and crisis resources, and about half say they don't think that their current campus resources are sufficient. So the question for today is, how do we ensure that faculty and staff are equipped to recognize and refer a student in crisis? What are the basic services that are needed on campus? And how do we create a greater system of support to identify and help students that are in need before a crisis actually occurs? And finally, how do we ensure that we're not siloing folks on different areas of campus, which would prevent critical information or behaviors from being noticed and referred? So let me start off by introducing our panel. First, we have Victor Armstrong. Vic is the VP for Health Equity and Engagement at the American Foundation for Suicide Prevention. He's a nationally recognized speaker on health equity and access to health care. And how to leverage existing community resources to fill gaps in access to care. So I think that will sound really familiar to anyone who's trying to manage on campus. In his professional career, which spans over 30 years, Vic has held many prestigious roles, including serving as North Carolina's inaugural Chief Health Equity Officer, Director of the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Use Services, and Vice President of Behavioral Health with Atrium Health. Vic serves on the steering committee of the National Action Alliance for Suicide Prevention. He's a member of the board of directors of the East Carolina University School of Social Work and the Council of Advisors for St. Augustine's University and RI International. He is a proud historic Black colleges alum and now works with historically Black colleges to raise awareness for student mental health and suicide prevention efforts. So welcome, Vic. Next, we have Eric Newble. Eric is an associate vice chancellor at East Carolina University and serves as the institution's freedom of expression officer. He has 30 years of experience in higher education, is responsible for leading the student life unit within the Division of Student Affairs. He's held leadership positions at Virginia Tech, Florida Atlantic, the State University of New York Maritime College, and the Fashion Institute of Technology. So lots of broad background there for those who are calling in from campuses. Dr. Newble is a first-generation college student and a passionate advocate for the transformative power of higher education. He holds certifications in incident command systems, crisis management, and the Department of Education's threat assessment, and is a North Carolina certified conflict mediator. So welcome, Eric. And finally, we have Adam Sargent. Dr. Sargent is the director of the Counseling Center at Colorado State University Health Network. He's also an adjunct faculty member for the University of Colorado Anschutz School of Medicine. Adam is a licensed psychologist. He's worked in college counseling for over 15 years. He helped design the I-Team, which is a post-hospitalization team specializing in assessing and treating students with suicidal behaviors at CSU. And Adam is bringing the clinical lens to our panel today, as well as the administrative lens as well, so that combination of the two. We have a lot to cover, so let's jump right in here. I thought we'd start out with talking about existing services and current gaps. So when it comes to crisis and suicide prevention, let's talk a little bit about what campuses are doing right and also where the gaps are. And Eric, I thought we would start with you because you've worked across a variety of different campuses of different sizes. So what are some of the gaps that you have seen, and what do you think that the audience needs to know about what those gaps, what gaps there are, and also what's going well?
Right, absolutely. I always try to keep it to three things because my mother taught me a long time ago that you're going to forget after three. So the first thing that comes to mind, and I know as we say this, everybody's going to be shaking their head saying, "Oh, that's my campus," or "I know that." Um, Optional training versus mandatory training, right? There's only a certain group of individuals on a campus, and I know we'll talk about that a little later about who gets this training that go through a mandatory training. And there's so many things now, especially at state institutions, that are required training, that it's kind of a loss that this particular issue, especially one that affects our campuses so much and sees so many young people around the country, leading cause of death, right, on college campuses, that is an optional training, because you don't know when you're going to approach it. You know, I wish that suicide ideation only happened in front of, right? It's usually coming up in front of anybody, custodial workers, students, faculty, but also the staff that are working and leading in the institution. So I think that sense of community is we're all going to be trained in it together. Another gap, I think, is that this idea of we forget that this training needs to not just happen suddenly in college. And I know we're talking about the collegiate environment, but I feel so passionate. We see so many things that aren't addressed in high school that all of a sudden, not only because they're not addressed, grow in high school, but also the students have no awareness of where support systems are and where they can get help. And then they plop them into college, and now you have all the stuff that they are totally overwhelmed by, right? And so I think when you look at training, I think training needs to be aligned, like many things, with high school into college. So there's a seamless transition, not just for our students academically, but for our students socially and mentally as they transition in. And the final thing is this idea of a mixed methods approach. You know, I'm going to take the academic lens a little bit, although I admittedly shied away from mixed methods when I was doing my doctorate because it seemed scary. But this idea of a mixed methods approach, you know, I think we can go across the country, and aside from maybe a handful of different programs and trainings, you'll see on college campuses, everybody's doing kind of the same things, right? And have been doing a lot of those things for many years. And they have a benefit, but we need to look at other things and not replace, but blend them all together. Like, how are we hitting the community, especially when you're talking about diverse institutions and institutions that are like my institution, hovering around 30,000 students, right? You know, 3 or 4 training or concepts that you're trying to get across doesn't work for everybody. So how do we then pepper in other ideas to make sure that we're pulling them out? Those are the things I think that really identify 3 gaps that are important to me. Just real quickly, when you jump right into what's working well, I'm going to brag a little bit. I think what we do really well at East Carolina is that we do focus on that mixed message approach. We have put in telehealth. We've gone from traditional counseling to, you know, telehealth, but also group counseling, peer counseling. You know, we're looking at this concept of don't bring students to the program. So often, especially in the student affairs side of things, we would do programs and students have to come to it, right? Now we're bringing the programs to the students. Like, where are you at? Where can we set up a pop-up table? You know, where can we set up a pop-up event? You know, you're going to be in the lobby of this building. We're going to do a program in the lobby of that building because that's where everybody congregates. In the dining hall, they congregate in the dining hall. We're going to be there. So I think this idea of bringing programs to students and back, but when you combine that with traditional counseling, with traditional types of outreach programs that you do, as well as trainings, you develop this mixed methods approach that's hitting a lot of different types of people and types of communities on your campus.
Mhm. Yeah,
You know,
absolutely.
I did know want to touch on that because I think one of the really key points that Eric makes, I think, is it's about community. I think sometimes we think about the role of the college campus as being kind of separate and apart from the students' community, but this is their community. This is where they live, and I think a lot of the way that we approach um, mental health and suicide prevention and awareness at the community level translates to the college campus. And I think that one of the things that we sometimes don't pay as much attention to is that when we work with communities, a lot of what we're learning from communities is that we need their voice in telling us how to design the programs and the things that we're going to use as outreach for those communities. And I do think there's room for us to engage students more in having them tell us what works on their campus, and especially when you start drilling down into specific populations on community on campuses, because when you think about all of the different people that come together on the college campus from all these different places, all over the world, not just across the country, but all over the world. They come from very different places. They've had very different conversations about mental health and suicide. When I talk to students on historically Black colleges, for example, for a lot of them, it's the first time they've had a conversation collectively around suicide. And so it's a very different conversation for them, oftentimes, than it is for maybe students who have been socialized to feel a little bit more normal, and their conversations become more normalized to them.
That's an interesting point, Vic, and I'm wondering if that also applies to approaching faculty and staff, because certainly faculty and staff on campus will be from tremendously diverse backgrounds as well.
Yeah, I'll tell you one of the things I found in one of the colleges that I approached last semester, and it was an HBCU campus, about doing some suicide prevention training on their campus. And the feedback I got from them was they felt like it was a conversation that needed to be had, but they were very uncomfortable with starting, particularly with faculty, with having a conversation around suicide, because they had not had any other mental health conversations, and they didn't feel like they could start with suicide. So it's really important that we start having these conversations and getting faculty and students accustomed to having these conversations, because I've experienced the same thing with communities. I was invited to speak at an event for a program a couple of weeks ago, but then this particular community is one that has not had a lot of conversation around suicide, and they came back to me and said, because your organization is called the American Foundation for Suicide Prevention, we're not sure we're ready for that yet. So it is really important to get faculty comfortable with having these conversations in addition to the students.
Mm-hmm. Yeah, I think that's a critical point. So, Adam, I wonder if you can talk a little bit more. One of the things that we're always concerned about, I think, with campuses is that there could be siloed departments or various entities on campus that aren't in communication with each other. And I think Colorado State, to brag a little bit, has really addressed this in a unique and pretty effective way by creating their student council team. I wonder if you can talk a little bit more about what's working well at CSU and what you've learned along the way as you help to develop these systems.
Yeah, be happy to. I really, to segue from what Vic was just highlighting, I wanted to say that I think creating a campus culture of care really, really matters. So building that community and making sure that mental health doesn't just live within the counseling center. If you've got a counseling center attached to your campus, for example, I think that's a mistake. I think maybe we could get away with that for some decades in the past, but I think these days it's really, really important that mental health and just sort of having a culture of care across campus is so important, which leads me to probably the biggest takeaway lesson. I wanted to talk about some of the kind of key ingredients I think that we've had that have really led to our success at CSU. One of those is having sort of a home base, like a hub, if you will, for all of these issues to take place. We call it the student consult team, like you mentioned a second ago, Nora. Some campuses call it a BIT team, a care team. There's different names for the team, but what matters is that there's sort of like a central place where people can gather. They can share their resources, they can share their wisdom. Students that have been identified as, hey, I've got something going on, they may be struggling with their mental health, they may be experiencing suicidal ideation. That information can come from anywhere. And if that lives in the counseling center only, counseling center, as many of you know, is going to be a little bit of a black hole of information because of HIPAA, right? Like a lot of information can come in, but not much information can leave. So the first thing I would argue is, as an active ingredient that really helps in terms of building community, is to have some sort of centralized hub where people can gather, and that it probably exists outside of HIPAA. And that might mean that there's a team that's built or something that exists on campus elsewhere. At CSU, we built an Office of Support and Safety Assessment. We also built a student case management team. And again, those are partnered with counseling services. We certainly interact with one another, but they can exist under, say, FERPA instead of HIPAA, and it can be easier to have communications go from one place to another. So that's the first ingredient that I think is important. The other thing is it's got to be simple. Whatever we do in terms of how do we transmit information. If I'm a professor, I'm teaching a class, I'm busy. If I'm in the Division of Student Affairs, I'm busy doing whatever my main job is. So having a culture of care doesn't mean that everyone has to be a therapist or a practitioner, but it does mean that everyone needs to know, what do I do when I hear information that worries me about somebody? Where do I deposit that information so that the right person can pick that up at the right time and intervene in the community? What CSU did was build what they call a tell someone line. And I know there's lots of parallel systems that exist on other campuses around the country, but it's just sort of a central line that exists. Ours does get routed through that Office of Support and Safety Assessment, but it's connected to student case management and connected to the counseling center in the sense that that information can come from anywhere on campus. It could be a peer, it could be a professor, it could be somebody in the Division of Student Affairs. Anywhere on campus, there's one number that they call that hits that central hub, and the person that sort of hosts that line at the central hub then can connect it out to the different resources, because maybe that person just needs connected with treatment. Maybe they're getting lots of reports about a student that's of concern that needs a reach out. Well, then the student case management team can reach out and connect with a student outside of a counseling environment, for example. So having both a simplified, easy kind of one-stop shop for communication, and then having a hub, I think is really key and really critical. And then the other ingredients, of course, I think is if there can be treatment, like you mentioned earlier, how can we hold students on campus? Can there be treatment close to home? So can there be a college counseling center or some sort of access to get people care once the need is identified?
Mhm. I think that was one of the things that was very unique about CSU's I-Team that Adam helped to build, was to be able to take even those most concerning or most high-risk students and be able to hold them close during a time, maybe post-hospitalization, when the risk levels are actually highest. So trying to really provide that wraparound support. We had a question that actually came in before the webinar asking kind of, how do faculty and staff know what the signs are? What if they miss something? You know, what do they have to be well versed in recognizing mental crisis or mental health care? And Adam, as from a clinical lens, what are your thoughts about that?
Yeah, great question. I'd say everybody go get a PhD in counseling psychology. I'm just
Exactly.
kidding. No, I think it's a beautiful question. There's actually neat programs that exist, and there's a few, and I certainly don't know them all. Notice and Respond is one. QPR is another that I know college campuses use, where there's a built-in sort of module or training component that some shop on campus can shop around to the other departments. So I know, for example, CSU takes it to faculty council. So faculty get exposed to what are the signs and symptoms and things we should really worry about.
Mhm.
And it would be the things that might just come to mind that make logical sense, but it's really good to centralize those things. So increase in substance use, big social withdrawal, people isolating or not showing up in the way that they used to. Those sorts of signs and symptoms that we associate with suicide, for example, there's training programs and protocols that you can shop around to different areas. So we would train faculty and staff at CSU. All the RAs in housing get trained in this, for example. People can also request that trainings come to their area. And as part of that training, they would go through, here's the top signs and symptoms that we're concerned about. And then the second part of that that's equally important is then here's what to do.
Mhm.
And then say like, oh, go ahead.
No, I was just going to say, I think it's the here's what to do piece, and to have something simple and at their fingertips so that faculty don't, like you said, have to be experts in the field. But if there's any question or any concern, they know exactly where to send someone. Vic, I wonder if we can get your perspective here. You've worked specifically with historically Black colleges and universities on crisis and suicide prevention awareness. What do you think are some key components that need to be included or addressed within a campus system? I mean, really, regardless of size or resources.
Yeah.
From
So
a
one thing, and I think Adam touched on this. I think one thing is to try to keep it as simple as you can. I usually talk to folks about when you're looking for signs and symptoms, to think about changes in talk, mood, and behavior, and look at there are things that people may say if someone talks about suicide, then you need to take those kind of things seriously. If you're seeing significant changes in this person's baseline, the way that and because everything is specific to that individual. If this person is someone who's always been an outgoing individual, and now they're very subdued, or vice versa. Those kinds of things, behavioral changes in mood, if someone becomes very sullen, those kind of things. So I think all those things are important. I think where sometimes things are a little different, I think is it kind of goes back to this the conversation we were having earlier about community, I think. And one of the things that I always reflect on is growing up in rural Eastern North Carolina, son of a preacher. My narrative around suicide was that suicide was not a Black issue, that suicide was not a Black problem, that it happened to other communities, it was other people's issue. And that narrative was wrong. But there was also no narrative coming from outside my community that was telling me, no, this is about you. No, we do want to include your community in this. And so I think for a lot of students on minority serving institutions, HBCUs, they have been socialized differently around this conversation. And so when you take them now and put them in an environment away from their community, away from their families, and you're giving them information that's very different from what they've heard, they're going to hear it a little bit with a little bit of skepticism initially. At the very least, they're going to think, well, it probably won't happen to me, because they've been told their whole lives it's not something that's going to impact them. And so I think what we have to think about is that because people and college age students are very social, and so they find within that college community, they find their community, they find their clique, they find the people that they feel like they have the most in common with, that they want to be around. And when they find themselves in crisis, when they find themselves at a point of either severe depression or anxiety or hallucinations or suicide, you don't at that time seek out something that's very new and different and strange to you. Mm-hmm. You want safety, you want community, you want familiarity. And so part of what I try to share with these campuses is, if you have not introduced students to these resources and made it a normal part of campus life, that these resources exist, they're here to support you, because they need to see themselves in those resources. Because once you're in crisis, you don't go and seek out things that are strange to you. You seek out things that make you feel comfortable, that make you feel safe. And so one of the things that I stress, especially the colleges, campuses, where they have a majority of students who maybe have not had these conversations, is you have to put a lot of emphasis into normalizing this conversation. And it doesn't all have to come from programs on the campus. It can also come from partnerships with other organizations that can come in and offer training, because you also normalize that reaching out to other organizations. And so I think that's a huge piece of it, recognizing that you have to try to find a way to normalize the conversation, so that when the students do find themselves in need of it, it doesn't feel like something strange and contradictory to them.
Mm-hmm. It's interesting, most of the faculty that we surveyed said that they're not required to complete suicide training or crisis prevention training, and as many as a third of them hadn't done so. But all of them said they'd want more training. Eric, I wonder, when you're thinking about training faculty and staff, what are some of the things that institutions need to keep in mind? So, Vic mentioned really kind of being in the community where folks are, making sure that we're modeling discussions about mental health, about crisis, normalizing that on the campus. How about specifically when you're looking at training faculty and staff?
Sure. And before I answer that, I just want to bring up a point that Vic had said that really resonated, is you turn, when you're in crisis, to people and communities that you've built trust with. And so I think of that word trust. This and the answer to your question are pet peeves of mine. So I'm going to be a little passionate. And I'm a New Yorker, so I move my hands around a lot. Sorry. Trust is not built in 60 or 90 minutes in a classroom. Trust is not built by welcoming somebody into the building and then they walk by you, right? Or sitting in your office and putting on a program. Trust is built with communication, with sitting down and starting conversations with, how are you doing? Like, you don't have to be worried about this person to start a conversation with, this is who I am, this is who you are, how are you doing? How's everything going? whether you're talking to a faculty, a staff person, or a student. And we don't do enough of that in the college environment. We are so busy and we're running from place to place, students and faculty and staff alike, that we don't just stop and say, how are you doing? Right? We see numbers. We deal with data, right? Everything now is data funding, right? Especially in the state of North Carolina. We're not actually, if you want to really truly build what Adam talked about, that culture of care, you got to build trust and show that you care, right? And so I think when you backtrack to your initial part of your question, the other part of my pet peeve is that we, and I can say this as a recovering SUNY employee, SUNY is a great system. It's they tout themselves as the largest state system in the country, right? California would be larger if they combine their systems, but they don't. But one size does not fit all. I cannot tell you, having worked in 4 state systems, how many times we say that to donors, to legislators, to one size does not fit all. Whether you're in the same state, whether you're in the same region, right? Vic talked about, this idea of Eastern North Carolina. We are proud of our Eastern North Carolina heritage and what we do in North Carolina. But from Elizabeth City down to Wilmington, they are different schools and serving different populations. And this idea that we're always looking at training as one size fits all. Like, what does a counselor need as opposed to what does an RA need, right? To what does a first responder in the Division of Student Affairs need? To what does a custodial person need, right? We forget about the custodial people. We forget about the maintenance staff, right? What do they need? And this idea of developing training programs, and we should all form a company now, no offense to Mantra, and start this, right? But training programs that are built to different communities. So you can almost take a menu of programs, slice them together, because that's what people need. Is that I just need to know what the signs are, how to communicate, how to have an open dialogue with somebody. I just need to know, where do I send somebody if I'm concerned? Where is the online that I put an online request or a phone call in? Like, I might need to know just what to look for and see something, but I don't interact a lot with people. But I want to know, like, there are different levels of training. And again, we are stuck in this one, and I know it's constrained budgets. Resources are tight across the country. And that leads us down this road of a lot of one size fits all, but that's a real concern. So again, pet peeve, one size does not fit all. We need to work on trainings, especially if we're going to make this truly community-based trainings, right? Different types of training for different communities, different levels, different students, right? And also this idea of, for goodness sakes, when you walk up to somebody, don't start the conversation with what you need, right? Maybe start the conversation. Even when they walk up, I like to sit at the front desk of our student center because I feel like that's the only place I get told thank you and give me a high five because I'm in my office handling problems. So when I sit there, they walk up, the first thing I say is, hey, how are you doing? Where are you from? They're wearing a Boston shirt. Yankees rule. Boston sucks, right? You throw out different things, you build a conversation, and then you share a name really quick, and it only takes a few more seconds. And then you start to build that relationship, build that level of trust, like Vic talked about, where they're going to actually come and talk to you because they, I know you, Eric. I know you, Dr. Newble. I want to come and talk to you.
Yeah. Part of our challenge, Eric, I think, healthcare in general and behavioral health even more so is a very transactional space. We do something that we can draw down money for. That's how we get paid. We do something, we fill out a form that says we did this. And so, we do something and I give you something, you give me something in return. But community is not built transactionally. Community is built relationally. And so again, if we want students to trust, and I love that you framed it that way. It's about trust. If we want them to trust us, we have to form relationship. And even in an academic setting, there oftentimes is this perception from students that even that space is very transactional. You give me an assignment. If I give you back what you want, you give me a good grade. If I don't give you back what you want, you don't give me a good grade. And that could be the only relationship that we have, unless there is an effort to make it more of a relationship and less of a transaction. And that's where I think, that's where our challenge is. How do we make it more relational, less transactional?
You know what baffles? I'm sorry. I was going to say, what baffles me, Vic, is work is hard enough. Meaningful, but hard enough that those little interactions that build trust, that build relationship, that's what makes work enjoyable. That's what makes my life enjoyable. Why wouldn't I not want to fill myself with more endorphins and get happy and smile
Yeah.
instead of just go about doing my things and putting my cogs in my spaces?
Yeah.
Well, I think especially if you're in a field where you've gone into it to help, right? And Eric, you
Mhm.
brought up mantra, so I just have to say, one of my pet peeves is this idea that we can just bring in some third party and plop a bunch of students there. They don't know what campus, they don't know our resources, they don't. That really concerns me because I think you, in your mind, feel like you are offering mental health care, but you're pulling those students out of their support systems and out of their environment. And that's something that I think if you're thinking about telehealth, especially third-party telehealth, you really want to think deeply about what is that company doing to integrate into your campus. And that was one of the reasons that we built it that way, was because I don't think you can do good crisis care if you don't understand the environment in which your students are living. Research tells us that interventions and trainings targeted at students themselves are really what's most effective as far as preventing suicide on campus. And we know students, like we've already mentioned, tend to go to peers in crisis. So, Adam, let's switch back to you for a minute. How can faculty and staff work with students to promote training and awareness? I think this has already come up in the conversation. We've answered this in some way, but I'm just curious from your perspective, what we're missing still.
Yeah, some of my answers might seem a little unusual, and poke me if you want to redirect me in a different direction. But some of the answers, both from Vic and Eric, have got me thinking about some things. One is, especially if you're in a non-mental health trained sort of space, so you're in an academic space or in a division space, and you don't have that background. A lot of the questions that we get asked is, how do you feel comfortable in these conversations? And as somebody who has these conversations for a living, I want to say you don't.
Mhm.
I don't think you get comfortable, and I think that um, I want to say that here to all of you, because I want to normalize that it can be hard, it can be sad, it can be heavy, it can be awkward to have these conversations. If we're truly talking about some of the ideas that Vic and Eric were sharing earlier about customizing this to community, we can drill down even further and customizing this to per person, per interaction with a person, because their family might have been different, their particular slice of their community might have been different. There is no possible way you could ever know everything about everyone and have the right answer for that person. You can't. One of the best things you can do is try. You can care. You can engage. You can try to build that relational thing, but you might get it wrong. You might not know what to say. You might not have been there before. But trying is really what counts. Noticing is what counts. Being there is what counts. And so I'd love to wrap our minds around the idea of never feeling quite good at this or never feeling quite
Mhm.
comfortable at this is okay. I actually think that's more what professionals do. It's not that they get good and comfortable, is that they get comfortable with not being comfortable and not being great and trying anyway. So I um, wanted to mention that. Will you push me back again in the direction of the question?
Yeah, so we're talking about, I think that's an important point. I'm glad you took a little bit of a sidestep there to make it, Adam. It was, how can faculty and staff work with students to promote training and awareness? And I think
Oh,
we've
yeah.
touched on this a little bit already, right? In terms of making this a conversation that's normal.
Yeah.
Are there other pieces that faculty and staff need to be doing or could be doing?
Yeah. Again, my answers might seem a little unusual, but I love anything that normalizes mental health outside of the um, um, sort of outside of the box. I think a lot of times when parents ask, how do I make my student engaged, that sort of thing, or when a partner asks, how do I make my fiance, my partner, I often like to say, be the change you want to see. Make sure you're attending to your mental health. I think normalizing conversations and dialogues about mental health, talking about things like emotions, I think can be really powerful and important, particularly if you hold a position of power where students are looking up to you. Knowing that you do, kind of like Vic was mentioning earlier, do you know how to reach out, ask for help, engage across community, across department, across agency, that sort of thing. Um, Really sort of modeling that behavior for students, I think, can be really, really powerful. Some very practical ways, I think, making sure that you're really aware of what resources are in your community or on your campus. I think, say if you're faculty, for example, you can really practically list those sorts of things on materials that you have, the websites you use, the, say, syllabi that you create. Um, but hosting things like office hours, or having sort of the resources, the ways in which you sort of represent yourself, how you talk, what you share about your own experiences. I think all of that, anything you can do to sort of model and normalize, I think are very low hanging fruit.
Mhm.
You know, and I think too, it's really important, I think, that we understand that suicide itself, as we talk about suicide prevention, suicide itself is not a disease. It's the worst possible outcome of a combination of a lot of complex things that often includes mental health challenges.
Mhm.
But if that's the case, that means that we also have opportunities to intervene before a person reaches that point of suicidality. And I think sometimes the conversation needs to be, you don't even have to talk about suicide to talk suicide prevention, because you can talk upstream, and that's an easier conversation to have. So I think, you know, some of normalizing the conversation is helping people to understand that, first of all, suicide is a health outcome. It's not a criminal act. It's a health outcome. And if it's a health outcome, there are things that we can do, just like with other health outcomes. There are things that we can do to help ourselves not to take that path. And so part of the conversation, I think, around normalizing the conversation and around being more relational and understanding those nuances, and not even, you know, even as Adam was talking about, not feel like you have to be comfortable in this space. It is about recognizing that one of the best deterrents to suicide is social connection. And so part of what we have to do is think about how are we helping students and faculty to feel socially connected. People who experience suicidal thinking generally have either lost social connection, lost hope, or both. And if we can do something to mitigate those things, we can often offset people that trajectory of a person who's on that path towards suicidality.
Mhm. I think that's absolutely true. Yeah, very well said. You know, and I think when we're talking about like LGBTQ populations, even a single person using a correct pronoun can cut the suicide rate significantly. So a single person who just saw that other person and acknowledged and honored them is enough to make a significant difference in that person's suicide risk. So I think when we're talking about, you know, faculty and staff, those are small things that you can do, is to really try to see the identity of your student.
Nora, so I cheated a little bit and looked over at the chat, and Sterling asked a really interesting question about this idea of the DEI changes that are happening in a great many of our states, right?
Mhm.
And how that affects the safe spaces, and how do you, and so I will tell you, as the person who's over all of our centers here in North Carolina, we've had some changes with policy in the state. Florida, Texas, I don't care what state you're in, none of these changes affect the student organizations. They are allowed to exist. They are allowed to form their student organizations. They are allowed to reserve space and have meetings. So what happens here, and again, this goes back to my pet peeve of, right, like, and also bringing students to them, bring yourself to them. Like, I spend an entire month hitting up our student organizations, and we have almost 500. I don't go to all of them, but I know the big ones. I know the big players, right? That will filter down to the other organizations. And you walk into rooms where I'm walking into Black Student Union, I'm walking into the Muslim Student Association, I'm walking into these places, and I'm able to say, hey, introduce myself, build that relationship we talked about, what the resources are on campus, and that there are people here that may not even look like you or sound like you that are here to support you, so much so that I'm coming to your space. So much of that relationship can be brokered when all of a sudden you, without being invited, is walking and asking if you can come to them and have a conversation. And as an administrator, from an administrative standpoint, that doesn't happen as much as it should on campuses, especially when you get higher up, to have those people come. When they're showing up because there's a problem, or they've been asked to come because of an issue, right? Or they need something, that transactional piece that Vic talked about. And I think that can happen at any institution, anywhere in the country, no matter what your laws, policies, and everything state. So I think that helps to bridge that gap a little bit, depending on what kind of policies and legislation you might be dealing with in your area.
I would add, though, that we also have to be mindful, though, that the very conversation we're having about the rollback of a lot of the equity funding and equity resources and equity policy in different states, including North Carolina, students see that, and that also impacts the mental health, mental well-being of students of color who see that rollback, and they, you know, they see that as being something that's saying that they are not worthy of resources. And I think that, to the DEI question, I think another thing that we have to keep in mind, and it kind of goes back to there's no one size fits all for suicide prevention, and that is that we are really dealing with, as we talk about the DEI piece, we have to be mindful that we are dealing with systems that were built on inequity, a foundation of inequity. And not just inequity in terms of race and ethnicity. They weren't really built to support rural communities. They weren't really built to support, you know, our aging population. And so there's a lot of inequity in the resources and thinking that one size fits all. And so we have to be mindful of that. And that means that we have to be that much more intentional about leaning in, building relationship, getting feedback from students and faculty about what resonates with them, what moves them, what makes them feel safe, what builds that trust. And we also need to look at how do we look into, whether it's the faculty or our student body, and find trusted messengers. Who are the people already in those those communities that people trust and look up to? There are students that are leaders. You know, we need to be looking at fraternities and athletes, and, you know, how do you get those voices involved in normalizing the conversation around mental health and suicide? And then the final thing I'll say is this: we also need to be very careful about calling something a safe space if it's not, because we will lose all credibility if we invite students to a space and say this is a safe space, but then we find out that they really weren't kept safe. There's a difference in a safe space and a brave space. But we tell students it's a safe space, but then they find out that there are repercussions to sharing, to making yourself vulnerable and talking about your mental health. They will not come back. And so we have to be really, really careful about, if we label it a safe space, we need to do everything we can to make it a safe space.
A really critical point, Vic, and one that I'm not sure everyone would have thought of, you know, in terms of how that impacts communities. Shifting gears for just a minute, unless anyone has anything else that they wanted to add. How about postvention, right? We know that that period following a crisis is really when suicide risk can be highest. What should we be doing about postvention care on campus? And is that one of the critical pieces?
And just to clarify, are you talking about after an event with a student that survives, say?
After an event with a student, after a crisis on campus that now everyone's talking about and thinking about. I mean, I'm being a bit broad there, I understand that.
Okay.
But I'm just wondering, you know,
Yeah.
in terms of if you are designing a program where you're talking to faculty and staff, do we need to be mentioning postvention as part of that?
Yeah, I gotcha. I think, again, community matters and belonging and connection matters. That's a theme that I think we're distilling out of our conversation so far today. What we've done at CSU, I feel pretty proud of, and it's a multi-pronged approach because it depends on the community we're talking about. Sometimes the community is students, and so that might live with, say, the counseling center and some student case management sort of departments. Sometimes the community might be staff and faculty, and they might be the ones, and their resources might look more like an employee assistance program or an ombudsman's office. It just really depends on the system and what resources sort of exist for those folks. But I think having a plan in place and having a team that's got some options. What we do at CSU is we send out essentially a menu of options, because every community is different, and that sort of says, hey, here's what we know exists in terms of resources for your community. Would you tell us which of these menu items fits you best? That's what we came up with, because it threads a little bit of a needle that was important for us, in that we had to have a handful of things we did each time, because we couldn't reinvent the wheel with every single crisis on campus, with as high utilization as we have with our counseling services, for example. But at the same time, we knew we needed to customize for different areas for different people. Sometimes what administrators think that their staff needs is very different than what their staff actually needs. And so a lot of times the person that might be running the postvention might say, yeah, give it all to us. We want therapy, we want this, we want that. And we show up and it turns out that the participants don't want that at all, or nobody shows up. So we're also very intentional about making a lot of our resources voluntary versus forcing resources upon people at a mandatory staff meeting or something like that. Some lessons we've learned along the way. So anyway, a menu of options and having something that's pre-built. Again, really love what Vic said earlier about when things are hard and stressful is when we need things to be really, really easy. And so the more effort we can put into this ahead of time rather than scrambling each and every occasion, the better off we are.
Mhm.
Yeah, and I think it's also important to note that, you know, people and institutions often mistakenly think it's safest not to even talk about it or to pretend it didn't happen, which really only serves to really increase that shame and discourage the help-seeking behavior and adds to the stigma. So I encourage us, you know, one, I do think it's important to have a plan ahead of time, because when you're in that crisis, it's not the time to be scrambling trying to figure out what to do. So I agree, you need to have a plan ahead of time. And I think you also need to keep in mind that a lot of what you have to deal with after a death it revolves around communication. And so having a toolkit that provides information on how to best communicate and support the school community and manage the crisis response, I think, is really important. And that means, you know, having information on how to help students cope, how to communicate with parents, because parents are going to want to know that their kids are safe, how to work with the community, and how to engage those external resources. I think all those things are important because those are all things that are going to come up. You know, if you have students, and I think Adam touched on this, if you have students or faculty that need support, do you have those resources that you can connect them with? One of the things that we do at FSP is we have a toolkit after a suicide, a toolkit for schools. We have it on our website, and it gives you those pieces that you can kind of plug in. But I always encourage people, institutions, to really look at those resources ahead of time and have a plan ahead of time, because again, when your campus is in crisis, the last thing your campus needs is for the leaders to look like they don't know what to do, but for the leaders to panic. And I think
Yeah.
having a way of saying to them, let's just breathe. We're here together. You know, you're not alone. Let's work through this. Is calming for students, as opposed to having them feel like, you know, my whole world is just falling apart. And especially, you know, again, if I'm coming from a community where I've been told that, you know, suicides don't happen in my community, and then I'm on HBCU campus and somebody dies by suicide, it just, my whole world now just seems to be in disarray, because I'm away from my family, I'm away from my community, but something has just happened that's contrary to everything I've ever been taught, everything I've ever been told. What do I do with that? And so it's extremely important to be able to have a calming effect on the campus during that time, and to have a calming effect on the community.
Yeah, one last thing I'll add on that point that I forgot to mention is when we do postvention, we do that in partnership with the existing community. Because I think a mistake that gets made a lot is that folks say, let's bring the experts in, you run the show, you do the programming. And another way to put that in the context of the conversation we're having today is bring the strangers in
Yeah.
and have them do the healing. And that doesn't work nearly as well as if we come in and partner. So we build
Yeah.
maybe some framework and some infrastructure to make people as comfortable as possible. Again, not comfortable, but we come in and partner with the existing community to help them process, facilitate, triage, whatever they end up needing as part of a postvention. But I think partnering with existing structure and community is really, really key. Because again, a lot of the professionals are going to be strangers to the community
Yeah.
at that point.
And
I
you've got
think-
faith leaders on campuses too. I mean, it is a community. You've got all kinds of leadership there on campus. I'm
Mhm.
I
sorry.
think, no, it's okay. And I think, Vic, when you were talking about especially how the leadership might look, right? When that's happening, you know, having done all these events, and I'm still a crisis manager in some areas, one of the things we do all the time with event planning is we do a walkthrough, which is basically like a tabletop
Yeah.
exercise, right? That we see that happening a lot with active shooter training. And now we're starting to see more and more of that happening with protests and like, let's walk through with a bunch of diverse people, like Adam said, in the room, right? And it's particularly leadership. So they have an understanding of these are the nuances of the situation. This was going to happen. And I think there's an opportunity to extend that into this kind of a world when we look at the postvention, when we start to say, like, what's going to, yeah, we have a good plan. We've gotten some good resources. Let's walk through it. Because what chances are when you do walk through it a little bit, you notice that there's some nuances that have to change based on your institution, based on your community, right? Based on somebody in the room saying, well, that can't happen here that way because we don't have this computer system. Our software doesn't allow us to do that. Okay, so how do we make that happen, right? And so unfortunately, so much of that happens in an active situation. You try to take notes and you think you got it down for the next time, and then you hope the same people are around the table and have the paper in front of them with those notes, right? I think there's a real value to having, I know that people like calling it the tabletop practice exercise, but just a walkthrough. I mean, that's what we
Yeah.
do with every major event. We walk through with all the players, police, everybody, just to say, visualize what's going to happen. Where is this going to go? What's going to happen at the end? Who's the players? What you take the lead on that? Okay. Oh no, you're going to take the lead. Okay, that's a better idea. That kind of thing. And I think more of that, particularly around suicide, can help colleges to work through the situation better with their communities, but also I think it puts leadership in a much better position to be able to impact
Yeah.
and be supportive of what the campus needs.
We had a question that came in that I think speaks to this, and that is, have you had any struggle getting administration on board with this community care model? And how do you relay the importance to them, aside from telling them to watch this webinar?
So administration is a broad term. We're all not built the same, right? Like I would argue that, one of the champions of this because of its connection, but also a lot where counseling centers and stuff live is the student affairs division, right? But I think it's crossing over the divisional lines. We know institutions of every size are so siloed. These are siloed niche communities where you have rank and privilege that is addressed even beyond what we see in corporate America sometimes, right? There's rank and privilege and I report to them and this is my bucket of money. Nobody can touch it, right? And I think it's a top-down approach, honestly, because I think the grassroots folks already are trying to work together. But if the top down, the leadership, and I'm talking really top, don't work together to bridge those divides right away, to almost lead by example, to show this is how we're going to partner and work together, you're not going to be successful. But I think when you're talking about administration that way, I think that every division, beyond even student affairs, all have champions for this work, right? This issue has affected everybody in some form, friends, colleagues, family, right? This is a national, a global issue. So there are champions everywhere. It's a matter of how do we get them to talk to each other, and then how do we get the resources and support from top down to say that these divisions and these big siloed machines are going to work together and not be stuck on territory.
Yeah, such a good topic and such a good point. I feel super lucky at Colorado State University. We had a lot of support even coming from the Board of Governors, and we got a lot of top-down support, and that's what got things moving. A lot of times tragedy can spark resources, which is always tragic, of course, and I think that all the better if we can sort of get support from administration higher up the chain, the better. I think if resources and finances are coming in to build infrastructure, I think that starts getting things moving. Sometimes we're not in a role where we have any ability to move that needle. If I get asked for advice on how do you do that, how have I been successful at doing that at times, when I might not be in a role where I get to move the needle on resource allocation and that sort of thing, I think making sure that you're as aware of best practices, knowing solutions, how have other places done it, and passing those things around, making them be known. There's really great publications to support kind of what a best practice should be. Every institution and every administrator typically wants to say, hey, we want to be at the cutting edge, we want to be the best. And if they're aware of what's out there, sometimes that's the loudest voice that you can have, is to share resources, share research, and and talk about what other places are doing. Some of that, I know that in my world, my community with other folks, whether they're in my discipline or not, but being connected with other campuses and being involved in activities just like the one we're doing today is part of where I've learned some of the best that's came across my desk. And then I share that and pass it along and try to build some momentum, even if I'm not the one holding the purse strings.
I will say, Nora, before Vic, and I'm assuming Vic's probably gonna jump in. I think to what you said, Adam, is what are the goals of the institution? Understanding who are the players that are going to have access to those resources. What are their goals? Sometimes they are clear goals of the institution, sometimes they're not, right? But they're usually pretty transparent about what they want. And how do they say, whether it's a board of trustee member or legislator or whatever, they have clear goals that they articulate all the time. If you're watching, you might not always agree with those goals. That's the number one goal, but you know their goals. So if you can package what you need and show with data, right, and show examples of how this pushes their agenda, their goal, because all the goals are about the success of the institution, right? Everybody wants the success of that institution, but if you can package it specifically to what their goal is, you're going to pull on maybe not their heartstrings all the time, but you're going to pull on what their priorities are, and that's going to give you a better chance, at least at my level, for being able to sell something and get at least a trial run into something.
Yeah, I think too, it's it's like any I think any organization, it helps if you have champions. And I think one of the things a lot of times I think administrators overlook, and I find the same thing in work I do with faith-based organizations, and especially faith-based organizations of color, is part of it is making it relevant to them. And the data speaks to that, because a lot of people do like to think suicide impacts other people. It's the second leading cause of death for college students. There are like 24,000 suicide attempts every year with college students. And so it's not a question of whether you have students on your campus that are battling suicidal thinking. It's happening because you have students who are either thinking about suicide, maybe suicide attempt survivors themselves, maybe suicide loss survivors, and these are students and faculty, or they may be worried about someone else that they think may be suicidal. And so at any time, even in your administration, you're going to have people in your administration who've been touched by suicide. And I think, part of it is getting them to understand that it's a reality. It is here. You're not going to make people suicidal by having the conversation, but you might save a life by having the conversation. And I think if you can at least get them to identify a champion who can work in this space unhindered, I think that's a huge step. If you're not going to lead it, at least let somebody else lead it, and don't hinder it, because there are people, students and faculty, who need this, need to be having these conversations.
Shifting gears just a little bit, we're getting a lot of questions that are very sort of granular and to the point. So a couple of things. One is a question about working with students who are close to graduating, which is a time when there's a lot of transition. And I know that the traditional way in which college counseling center models are set up, and even the licensing in this country is set up, are so that you have to be local to where that student is to be able to provide care. And often the student needs to be enrolled in the school to be able to continue to provide care. So I'm wondering if there have been any sort of ways of thinking about that, or any recommendations in terms of how we keep an eye on those students that are getting ready to graduate or that are leaving campus, and how we make sure that they're not falling through the cracks.
Yeah, I could speak to that as both a clinician, kind of my clinician hat, and my administrator hat. As a clinician, I would say have that in mind early and often.
Mm-hmm.
It should be on your mind, even if it's not on the student's mind, that they're about to hit a transition that they've probably never been through before. It's probably the first time they've ever graduated from college. It might be the first time they've ever sought a new career. They're going to join a new community. As a clinician, I think having that in mind early and often and having those conversations is important. That might be true too if you're in a lot of different roles where you're connected with students. Just knowing that what they're about to experience might rock some of their kind of core foundational variables in terms of their well-being is just good information to have. And so having those discussions early and often, I think, is important. as an administrator, I think a lot about, do you have resources set up that this is just a known variable? This is going to happen. This is a success. This is actually what we're working for in institutions, is get people graduated and on to the next phase in life. So I think about, do you have sort of like step down, referral, transition things? Do you have a system set up where people's insurance isn't going to hit a gap? If they have student health insurance, do you have a way to extend that for people that need exceptions? Do you have good referral coordination systems in place to connect people to the community? Do you have somebody who has time in their work plan to be connecting with, say communities that might be outside of yours? Because we do have things like barriers of licenses can't cross state lines and that sort of thing. Like, is there a system that's in place, or could there be, or can we build one to be thinking about this so that it's not surprising us when these things happen? Because a good percentage of students are going to be very vulnerable right around that time.
Mhm. We have a lot more questions coming in, and I also want to be a bit mindful of the time. I know, Vic, you especially have another commitment that you're going to need to jump to. So I wanted to give each of the panelists a minute to sort of wrap things up. And then we'll stick around for those who can for about another 15 minutes to answer more questions. But given the limited resources, in each of your experience, what crisis prevention programs or services have you found to be most valuable? So if somebody's just trying to walk away from this with a checklist of these are the pieces we need to have on campus to sort of compare their resources to, or to try to prioritize, what would you put on that list?
For me, I'm a fan of keeping it as simple as possible. So, I think it starts with at least giving access to programs, if not mandating training in programs like QPR, mental health first aid. We have very basic Talk Saves Lives programming at AFSP that is kind of our suicide prevention 101. And I try to encourage campuses to allow that training to take place on the campus. For HBCUs, we have Let's Save Lives, which is an acronym for Listening, Empathy, Trust, Support, Saves Lives, but it is Suicide 101 for the Black community. We have our Talk Save Lives for the Latinx community. I would say we need to make all of those resources available to students on college campuses. One of the things that we do also at the FSP is we have, campus walks. And so we've tried to build relationship with campuses, but I think it would be important to take some of those basic trainings, make sure you're training both faculty and students in a lot of those resources. We also have Talk Away the Dark that teaches you how to talk to someone that you think may be experiencing suicidal thinking. And what happens when they push back? How do you respond to that? We have, step-by-step resources for all this. So I think, as much as we can make it very simple for the user, I think that's extremely, extremely important. And I think it also is a way of building that relationship and not waiting until something happens to begin to have those conversations.
Yeah. I'm going to jump in for just a second and just mention a little bit of administrative stuff here. There will be a Zoom survey that will be shared around at the end. So really appreciate anyone giving us any feedback that they can on that. And we are also going to share the recording. So if you have to step away early, or if you have a colleague that you want to share this with, we will do that. And so shifting back again, the final question, Eric, how about you? What do you think in terms of, with limited resources, what goes on your short list?
So I think what's worked really well, and it might have been driven because of really limited resources post-pandemic and the high needs, is the incredible job that Dr. Lanika Wright and her part of the division and student affairs has done, which is this mixed message kind of approach that I labeled it that. It's also going out and getting not just different ideas, but also getting different partners. And one of the greatest things that they did is they started partnering early and often last 2 years with our Student Government Association. And depending on what state you're in, student governments can sometimes have a lot more money, a lot more power, influence. And that Student Government Association got so many people in the large student government passionate about this, giving resources, money, time, and effort, that now we're starting to see splinter groups of students on their own tracking me down, tracking Dr. Wright down to say, we have an idea for a program. We have an idea for this. And And now when we have new programs, we're going to start piloting an Are You Okay? It's a program out of Australia. That's Are You Okay? And we have a team, and I'm on the team, and there are athletic people on the team, and there are students on the team, like, because we're all bought into this together. It's building that community, right? And so as you offer different things and you want to expand your portfolio of options, not everything costs a lot of money, but there's a lot of time invested in that, right? That the key is, I think, is to partner with there's usually 3 or 4 organizations on the whole campus that have power, right? In terms of money power. You're talking about student government. You're talking about, if you have Greek life, your fraternities and sororities. You're talking about your activities board, which puts on events and like, these are people who have a lot of influence over large populations of people, but also have a lot of money and resources that when they're bought in, we're seeing the fruits of that labor. And that's just splintering off into all these subgroups that are wanting to do. We had our interfraternity council that wanted to do the walk a mile in our shoes, right? When they get out the heels and they walk. And we had over, 500 men out there walking around the campus in heels and trying to bring attention to, violence and sexual assault and those kind of, and it was like, that would have never happened if we hadn't started engaging, I think, years ago with these communities as not just we want you to participate, but we want you to be a partner, a resource partner, and really be a part of this, not just your money, but your time, your energy, as we like to say, your time, your talent, your treasure, because we're pirates. Like, we want to make sure that they're invested, and that's now splintering off in all these subgroups, even in the residence halls, where they want to start new programs. And they built the relationships with our staff that they know exactly who to go to. And it doesn't have to be somebody in counseling. It could be somebody in the student activities office because they know the people in counseling, and that's who they built that relationship with. And it's just building this kind of ecosystem of care and support that is just growing beyond what we even thought it could.
Vic, you sent a quick note. I don't know if you have time to just speak really quickly to your comment.
Yeah. So we know that young people are 76% more likely to turn to a peer when they're in crisis, and that means that we know they're going to talk to each other. And so it's that much more important that we equip young people to know what to do when a peer confides in them. What we don't want is them going to someone who's going to give them bad advice, or someone who's gonna minimize what they're going through. So I think it's extremely important that we train both faculty and students in what to do if they think that someone is struggling.
Adam, what's your final bit of advice
Yeah.
before we jump to questions from the audience?
I've been going back and forth in my head between 2, which means I think they're just tied, and I have to say them both.
Okay.
One is very similar to what both Vic and Eric shared, which is like a notice and respond QPR type training. Just like here's what to notice, how to notice, and what to do if you see something, say something. But I also, the reason I'm torn is say something to who or where or to what resource. And so the tell someone line, something similar to that that we use, feels equally key. Having a central connected place or like a hub where some of this information can go that's very, very simple, a one-stop shop for receiving, hey, I'm concerned, or I care about somebody and I'm worried about them. I think that really matters. And when I think about the variety of people we have on this call and the different roles people hold and the different ways, different agencies and resources and things that people have at their fingertips, I think some sort of way to train people up on what to notice, and then some sort of system to capture, now what do I do with that? I guess those are my 2 key foundational things that I think really matter.
Got it. Well, we're going to shift just to answering some audience questions. I know we're running over, so folks have to go. Thanks again to our panel for being here and for having this important conversation. Really, really appreciate it. I'm just going to start continuing to throw out questions till we hit about quarter after, and then we'll send resources around afterwards. I know all of you have mentioned some resources that you found to be helpful, so we'll try to share those. But I'm just going to start jumping in, and Vic, we know that you have to step away, so when you do, just feel free to go ahead. And thank you again for your time. So how about online students? I mean, this obviously, as a mantra person, a previous mantra person, this speaks to my heart. But what about those students that are primarily attending online? How do we ensure that they're part of the community? How do we get these resources to those students as well?
Yeah, I think that's a great question. I think that there's a variety of solutions, again, depending on the system. Um, and I know that for some folks, that's partnering with somebody that can do a third party service that an institution might not be able to do themselves. And I think that can work really, really well, particularly if it's integrated with what resources already exist, like you were mentioning earlier, Noah. Um, the other thing that we've done within our system is that we offer a variety of modalities of care so that students that are primarily online can have remote services through the health network. And so we try to, they're not as popular. I expected them to be so popular coming out of the pandemic. I thought all students were going to want telehealth, and but leaving that option open, since we were all sort of pushed to move that direction while we were remote, we've kept that door open so that students that uh, might not be physically located in the same town, community, or on campus can still have that as an option. It's also nice for when people are sick, that they don't need to be coming into the physical space. And we've had that both with individual therapy and with some of our group therapy as well, which has been great for flexibility for meeting students where they're at.
Mhm.
Yeah, I think that's it's so hard with that community, right? Because um, I don't think it's really fully tapped yet. Everybody's growing their online programs. We did the same thing, Adam, in at ECU as we're using that blended, but our telehealth really helps a lot with a lot of our online students. Um, I think also this idea of community, because that's where keep going back to is trust, community. How do you build that in an online community?
Mhm.
Because it's much more difficult in that kind of community. And one of the things we're working hard at is trying to connect what things we take for granted on the campus, being engaged in student government, going to a student organization meeting. Like the new student center we just built, everything has virtual pieces to it, right? So there's opportunities for students to engage and stay engaged, whether it's certain platforms that you're using. But I think that student engagement piece, and that's really from the other side of it, looking at the student engagement folks in student affairs of how do we engage better and get the students that are online engaged in different facets. And again, sometimes they're adult learners, returning learners, families, right? They might not want to be a part of everything, but there's going to be something for them. And how do we engage them, engage across each other so they build that level of trust, they start sharing, and then you have these communities and pockets of people that are getting to hear some of the struggles and be able to share to certain resources and send information so that there can be a reach out, right? It's almost building that community almost becomes even more important within an online environment, because these people can feel completely isolated and alone.
Mhm.
And so I think that's hard. But I look at it from the other side of how do we in student affairs open up our communities better to our student populations. Um, and it's funny, Adam mentioned it. We get a new software. We've labeled it the Pirate Experience. It's great. All the students on campus love it, and we're like, oh, the online students, they're going to love this software. They're going to connect. They can connect all over the world. They can no, no, they're not really connecting that way. So it's I kind of feel like I have a handful of darts and I'm throwing it at a wall where the target is like this big, right? And I'm hoping something's going to hit at some point if I just keep throwing something at the wall. But I think when you can engage with a community of learners, even if it's through the faculty area, through project teams, right? And really have those conversations outside of just a lecture, right? And learn about each other and hear what's going on. You get to meet people and you get to also hear their struggles and hear what's going on. And that's where you can build that trust, but also identify concerns that you might be able to pass on to help.
Mhm.
I thought of one other thing for this community
Mhm.
that I've neglected to mention. At CSU, we use an interactive screening program, ISP. This is another way that I think you can
Mm.
contact communities that you might not otherwise have connection with. And it's a screening protocol where, again, it's another kind of tool in the tool belt where we will reach out to students that are not reaching out to us and sort of screen them first, and then we open the door. So it's just a way for us to identify any group or population that we might have concerns about for whatever reason, and sort of say, hey, fill this out. Let us know if you have any concerns. Hey, did you know that we have some resources that you've already paid for that are available to you on campus? I think tools like that, something similar, can be really useful in online spaces where you might not have the same sense of community and you might not be bumping into people naturally or having face to faces with people. I think screening then becomes a little bit more key.
I think one of the really critical pieces with telehealth that I've talked about before is that when someone comes into the telehealth system, we have to think about what are they missing by not walking into a counseling center, and making sure that we build those pieces into that telehealth model. Otherwise, I think we end up actually divorcing students, and maybe the students who are most likely to use the telehealth may be non-traditional students, maybe students with more stigma related to walking into a counseling center or getting that kind of care. So I think that's something really critical to think about as we think about engaging in telehealth, is making sure that we're not divorcing those students from the very resources that they really are entitled to, and making sure that that's kind of part of the system itself. Well, we still have a bunch of questions, but I think we do have to honor our time commitments here a little bit. But thank you so much to everyone who joined. I think we've kicked off a really, really interesting conversation here, and we will be sending out a copy of the recording and some resources. And maybe we'll try for a second conversation to kind of even dig a little bit deeper, because I think this is really all very critically important to our audience and to our students. So thank you, Eric. Thank you, Adam. Thanks to the audience for joining. And we look forward to hearing your feedback on the survey and to sending around the recording.
Thank you.